Dr. Robertshaw, do you think there's a stigma for alcoholics?
Absolutely, and the book talks about it, the problem as a bad habit, and it feels like we've spent 20 to 30 years changing the perception of alcoholism as from a social stigma, as something that's bad and sinful, to a disease, that there's a lot of evidence that there's genetic background related to it. And as opposed to saying,
But every
listen,
drunk isn't an alcoholic.
that's correct,
Okay.
Absolutely.
And those are the people we don't have any programs for. There's hardly any programs in our country who offer each individual, respect their dignity, give them a choice. A lot of the whole reason we have a lot of this denial happening is the profession.
I'm confused because I don't know then how we define an alcoholic. How do we define an alcoholic?
That's a very tough question. Some countries don't even define it.
The danger of her program is the one that it is a bad habit that people can have under their control, something that we know that isn't true for many people with cigarettes. We know intuitively that if you're a heavy smoker, you don't try to go 1 or 2 cigarettes. You have to go,
but do we say that they have the disease of nicotinism? I mean, that's a behavior that they can quit.
But its abstinence is the only treatment for
We do say they are
drugs of
addicted
abuse.
to nicotine. We do say that.
They can get addicted to it, and they can choose to quit.
Amy.
Nicotine is addictive, though, and there are a lot of people that can drink and not become addicted to it. Anybody that smokes cigarettes is going to become addicted because nicotine's addictive.
More addicting than alcohol.
Is the most addicting substance, causing more medical, social,
Then how come
and
not everybody
family
becomes an
problems of
alcoholic
any
that
drug.
drinks?
Okay, that's a good question. Then how come not everybody becomes an alcoholic that
Because
drinks?
it's a disease in which we know that there's very strong genetic background, that people differ about their reaction to alcohol
And their ability to tolerate
and
it.
their ability to tolerate it, and their ability to control it. We know that when people
The
are
same
raised
thing
in
is true.
families-
It's perhaps, maybe, I don't know, I'm no physiologist, but the same principle may work for not everybody who smokes gets cancer. You know what I'm saying?
In countries where they don't, you know, don't have the disease concept as a way of treating people, they still, for chronic drinkers, they suggest the same thing, total abstinence. Whether it's disease or not, total abstinence for a chronic drinker. Now, for the problem drinker, we need to provide some options. Many people can reduce their drinking
Okay.
after
Do you all
problem
agree we
time.
need to provide some options, or are you saying there should not be any option? Do you agree there should be some options?